We have a number of pieces of equipment here in the hand hub to help patients with different issues that they might have with their arm. This particular piece of equipment is called Armijo. It's a robotic exoskeleton, and all that means is that the robot can help the patient to move their arm in lots of different ways. So we have a patient here, and we'll show how we actually set the patient up in the robot and how the robot can help her to move her arm. So Rebecca, can I get you to pop your arm up here? Lovely, thank you. And let's just get your hand around here. Fantastic. So the robot's very specialised and it can fit lots of different shapes and lengths of arms. We set this up earlier on to be suitable for Rebecca's arm. Okay. And what Rebecca can do now is we choose a game, and we also choose how much the robot will help her. So if she doesn't have very much movement in her arm at all, we can ask the robot to provide 100% support to help take her through the movement. Once Rebecca starts to develop better movement and she's perhaps not so stiff or better coordination, we can ask the robot or set the robot to help out a little bit less. So we're always trying to get the patients to do a little bit more, and we get the robot to support in the way the patient needs. So we'll choose a game here for Rebecca to practice moving her arm, and this particular game will help Rebecca move her arm across her body. Alright, so the game that Rebecca's playing here involves trying to catch the raindrop. Now, this machine's particularly good for people with multiple sclerosis who might have weakness in their shoulder and might be able to, say, reach forward for a cup, or reach forward to even put their arms through the sleeves of their jumper. So the machine, the robot, can help Rebecca to move. And what's really great about this game is that when Rebecca's moving the cup using her own muscles, it changes to a white colour. When the robot's helping more, the cup changes to a red colour. So then Rebecca gets feedback all the time, or information from the computer all the time, around what muscles she's using and where the robot's helping. And that helps her know which muscles to move. The other way that it's good is for people who might have a bit of shaking or some tremor in their arms, and the robot helps to control that shaking, that tremor, in helping to direct or aim properly to catch the raindrop. So you can see when it's changing from red to white. Red's when the robot's working, white's when Rebecca's muscles in her arm are working. So keep moving across, see if you can catch the raindrop. We can make this game more difficult. So as Rebecca progresses, the game can be made so that the cup's a bit smaller, so that her precision has to be better. She has to aim a little bit better, or to make it faster so that she has to learn how to use her arm faster. And there's lots of different game options on the robot, on this computer, and the games that we choose will depend on which muscles that we want to work on. So for MS, we find that we're often working on trying to get better control, less shaking, and to help the shoulder learn to move properly again. That's great. See, when it's white, Rebecca, that's really good because you're using your arm. So as Rebecca improves, we would move her on to the next piece of equipment. The piece of equipment that Rebecca's using at the moment is called the rejoist. It's a very exciting piece of equipment because it has lots of different options to work the muscles of the hand and the arm, and even to work balance. I'm going to just get Rebecca to show us all the different movements that her hand and her wrist can practice with this device. First of all, we can see that her left hand is on what we call a pull mechanism, which helps to practice moving the wrist and strengthening the wrist going up and down. So Rebecca, if you show that movement, and then coming back. The next one is our grip mechanism. So we can see that Rebecca can practice building up the strength in her hand by squeezing the grip. And we'll also go through and show how the games work with all the different mechanisms. The next one is our doorknob, and that practices turning the wrist from side to side. which is a really good piece of equipment, because then Rebecca can go home and practice that in terms of opening up her door, or even opening up different pieces of equipment and jars in the kitchen. We actually have a jar mechanism as well, where Rebecca can practice a twisting motion of the hand. Then we also have a pincer mechanism, where Rebecca can practice using her fingers and her thumb, pulling them up and down, and that's also a really important skill to practice, because it helps us with doing and undoing buttons, and even doing things like holding onto your cutlery. We also have our coin sliders, and that's practicing using 2 fingers together. So we'll demonstrate Rebecca playing a game. Is there a particular muscle or movement you want to work on, Rebecca?
Maybe turning the wrist from side to side.
Okay. Door. Yep, let's practice the door. And we'll practice with your left hand. So you can see that we have lots of options here in terms of how difficult to make the game, which mechanism to use on the rejoice, and also whether we want to work on the left hand or the right hand. So we're working on Rebecca's left hand, and we're going to practice the door mechanism. This game involves catching alternating coloured objects as they're falling from the sky and making sure that they match up. So we see that Rebecca has to twist it to be white to catch the white block, and then twist the doorknob again to catch the black ball that's falling. The exciting aspect of this piece of equipment is that Rebecca has a lot of fun and enjoyment in playing the game. So we know from research that that's really important in terms of making neuroplastic changes. Because we need to practice movements a lot in order to create new pathways in the brain, it has to be enjoyable. Otherwise, people either can't practice as much as they need to, or they're just not engaged or involved in the task. So we can see that she's already probably done 20 to 30 movements, and she's going up a level. So it becomes more complex. The task, as Rebecca is practicing the movements, she now might be required to catch more quickly, which means that she needs to move her hand more quickly, or even to move across the screen a little more.